Have you ever stopped to think that, as you read these words, someone somewhere in the world has just been diagnosed with dementia? It happens every 3 seconds. Today, more than 55 million people live with this condition, and the number is only growing. What many people don't know is that dementia is already among the leading causes of death on the planet, ranking 6th in this sad ranking. But what might really surprise you is that aging or genetics aren't the only villains in this story. Recent research has revealed something shocking. Certain common medications, yes, the ones many people keep in their medicine cabinet, may be silently damaging your brain. Especially if you're over 60, the risks increase even further. These medications, despite appearing harmless, have been linked to reduced brain volume, accelerated memory loss, and in some cases the onset of Alzheimer's disease. The worst part? Millions of people take them every day without realizing the damage they may be causing. It's a slow, almost invisible process. It starts with minor forgetfulness, then concentration difficulties appear, and before you know it, this can progress to a loss of autonomy that impacts not only you, but your entire family. If you care about your mental health and want to keep your mind sharp for years to come, it's crucial to understand what might be behind this decline. In this video, we'll show you 9 common medications that, according to scientific studies, are directly linked to the progression of dementia symptoms. And believe it or not, the most dangerous of these is among the most prescribed in the world, and almost no one suspects it. But that's not all. We'll also talk about 3 simple, natural, and scientifically proven foods that can help effectively protect your brain. And the best part, you probably already have at least one of them in your kitchen. Each of these medications acts differently on the body. Some slow down brain function, others disrupt communication between neurons, or even block the absorption of essential nutrients. The result, all of them, in some way, contribute to premature brain aging. Therefore, it may be time to review the medications you're taking and talk to your doctor about safer alternatives. Before we begin our list, please leave a comment with the city you're watching from. And of course, if you care about your health and want to continue receiving content like this, please like and subscribe to the channel. Shall we begin? In 9th place, first-generation antihistamines. Many people use these medications, like the famous diphenhydramine, found in Benadryl, to relieve allergy and cold symptoms, or even to sleep better. What few people know is that these medications belong to a class called anticholinergics. In practice, they block acetylcholine, a neurotransmitter essential for communication between neurons, especially those responsible for memory and learning. When acetylcholine levels drop, it's as if a fog sets in. You start to forget simple things, your attention span wanes, and over time, your brain can even physically shrink. A study published in the JAMA Internal Medicine showed that older adults who used strong anticholinergic medications every day for 3 years increased their risk of developing dementia by 54%. That's right. And the scariest thing is how it all starts subtly. You lose your keys, forget an appointment here and there, forget where you parked the car. Small things that add up. Because these medications are sold over the counter, it's common to think they're harmless. But the truth is, the danger lies precisely in this false sense of security. But in an already aging brain, the price to pay can be high, very high. Let's move on to number 8 on our list, benzodiazepines. If you've ever experienced anxiety attacks, persistent insomnia, or muscle spasms, chances are your doctor has prescribed a benzodiazepine. Names like diazepam, lorazepam, alprazolam, the infamous Xanax, or clonazepam are familiar to those who have experienced these challenges. These medications are powerful. They act quickly, calm the nerves, relax the body, and help you clear your mind at bedtime. But what few people know is what they do to the brain in the long term. These medications work by increasing levels of GABA, a neurotransmitter that decreases brain activity. Sounds great, right? Feeling calmer, less agitated. The problem is that when the brain goes into hibernation mode for too long, it begins to suffer. Continued use of these medications has been associated with memory lapses, mental confusion, and even physical changes visible on brain scans. A survey published in the BMJ revealed an alarming fact. People who used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's. And the scariest thing is that many elderly people have been taking these medications for years, unaware that they may be slowly digging a hole in their own memory. At first, the effects seem harmless. a bit of daytime drowsiness, slower reflexes, difficulty focusing on a conversation. These are all often attributed to aging, but that's not always the case. Often the brain is crying out for help. Both benzodiazepines and anticholinergics, like the antihistamines we mentioned earlier, have a similar effect. They offer quick relief but exact a heavy toll over time. One blocks memory messengers, the other forces the brain into chronic pause mode. And if you happen to be using both at the same time, then it's a recipe for cognitive decline. If you're currently taking any of these medications, don't stop taking them on your own. It can be dangerous. The best course of action is to talk to your doctor, understand the risks, and look for milder or even natural alternatives. The important thing is to find a balance between feeling good now and keeping your brain healthy for years to come. Remember, information is power. Review your prescriptions. Find the lowest effective dose. Adopt healthier lifestyle habits and pay attention to even small changes in your memory or attention. They can be early signs that something isn't right. Oh, and don't underestimate the power of an active brain. Activities like learning a new language, doing crossword puzzles, or playing an instrument are true mental gyms. They help strengthen brain connections and reduce the negative impacts of these medications. Let's go to number 7, proton pump inhibitors, known as PPIs. Millions of people take these medications to combat heartburn and acid reflux. Names like omeprazole, pantoprazole, esomeprazole, and lansoprazole are among the most prescribed worldwide. And yes, they are effective in quelling that unpleasant fire in your stomach. But does this relief come without consequences? Recent studies suggest that perhaps not. Epidemiological research has found a link between prolonged use of these medications and a more rapid decline in cognitive function. Furthermore, the risk of developing dementia also appears to increase significantly with continued use of PPIs. The problem isn't sporadic use. The real risk lies in chronic, daily use for years. These medications can interfere with the absorption of essential brain nutrients, such as vitamin B12 and magnesium. Deficiencies in these elements are directly linked to memory loss, confusion, and even mood swings. In other words, a medicine that starts in your stomach can end up affecting what's going on inside your head. What many people don't realize is that these stomach medications, proton pump inhibitors, don't just reduce acidity, they virtually eliminate gastric acid production. This may sound good at first glance, but there's a heavy price to pay behind the scenes. This acidity is precisely what the body needs to absorb essential brain nutrients like vitamin B12 and magnesium. When these nutrients are lacking, problems begin to appear. A B12 deficiency can cause nerve damage, blurred vision, and mental confusion. Low magnesium levels disrupt electrical communication between neurons, vital for memory and concentration. A study conducted in Germany with more than 73,000 elderly people found that regular use of these medications increased the risk of dementia by 44%. The most worrying thing is that many people take these pills every day for years, thinking they're as harmless as a regular antacid. They have no idea that sluggish feeling after meals, or that difficulty concentrating on simple tasks like washing the dishes, could be linked to the pill they take before dinner. Therefore, experts recommend frequently reviewing the use of these medications. Do you still need the full dose? Can you combine treatment with more natural measures, such as elevating the head of your bed, losing a little weight, or avoiding heavy meals at night? These simple adjustments can protect both your stomach and your mind. Now let's go to number 6, antipsychotics. When elderly people experience agitation, hallucinations, or mood swings, doctors often turn to powerful medications like quetiapine, Seroquel, olanzapine, Zyprexa, or risperidone, Risperdal. In many cases, these medications do help calm the patient, but the problem is what happens after the calming effect. These antipsychotics work by altering dopamine and serotonin levels, which are neurotransmitters essential for functions such as pleasure, motivation, and cognition. In the short term, the effect appears positive. The patient becomes calmer and less agitated, but with prolonged use, the brain begins to slow down excessively, and this leads to a sudden drop in mental energy, emotions, and worse, the ability to think clearly. The warning is so serious that the FDA in the United States issued severe warnings about the use of these medications in elderly people with dementia, due to the increased risk of death. Even in those without a diagnosis of dementia, continued use can have devastating effects. Thinking slows, The person loses autonomy, and they have difficulty even dressing themselves or paying bills. This creates a heavy dependence, not only physical, but also emotional, that burdens caregivers and affects the entire family. Therefore, if you or someone close to you is taking this type of medication, don't stop taking it without guidance, but talk to your doctor. Ask if it's still necessary to continue taking it, if there's a lower effective dose, or if there are alternative options. Complementary therapies such as music therapy, physical therapy, structured social interaction, and cognitive activities can be powerful tools in gradually reducing these medications. After all, the brain is like a house. It needs a solid foundation to stand firm, and each conscious choice today strengthens that foundation and can guarantee years of autonomy and lucidity tomorrow. Now let's move on to number 5, the Z-type hypnotics. As we age, it's common for sleep to become lighter and more fragmented. And in search of deep rest, many older adults turn to infamous sleeping pills like Zolpidem, Stilnox, Ambien, Zaloplan, Sonata, and Zopiclone. They promise to put you to sleep in minutes, and they actually work. But what few people realize is the neurological toll behind this quick relief. These type Z medications work by mimicking the body's natural sleep-inducing substances while simultaneously slowing brain activity. Sounds like a magic solution, right? But what happens behind the scenes of sleep is another story. These medications interfere with the brain's electrical rhythms and disrupt the deepest stages of sleep, those responsible for consolidating memories, organizing thoughts, and restoring the brain. The result is that even after sleeping for 8 hours, you can wake up feeling exhausted, spaced out, as if the night had been just one long blink of an eye without any real rest. A study published in British Medical Journal showed that those who use these medications frequently have a higher risk of falls and a greater likelihood of developing dementia. You know those stories about people who pace around the house, talk nonsense, or make strange movements in the middle of the night. This happens because the frontal lobe, the part of the brain responsible for control and logic, enters a partial shutdown mode. And for an aging or sensitive brain, this kind of repeated disconnection can leave deep scars, gradually affecting memory and mental clarity. If you've been having trouble remembering simple words in the morning or stumbling when trying to open your front door, don't dismiss it as a minor oversight. It could be the sedative from the night before still taking its toll. The good news is that there are alternatives, and they're more affordable than you might think. Improving your sleep hygiene can be a game changer. Establish a regular bedtime, avoid bright lights after sunset, and eat light meals in the evening. Breathing techniques like the 4-7-8 method or natural teas like valerian root also help a lot. And if you really need medication, talk to your doctor about milder options like extended-release melatonin or even cognitive behavioral therapy to effectively treat insomnia without side effects. The goal here is not to demonize these medications, but to reduce overuse, addiction, and above all, protect your synapses, because your mind deserves rest, but it also deserves clarity. Let's go to number 4, tricyclic antidepressants. Depression in old age often disguises itself. Instead of obvious sadness, it manifests as body aches, constant fatigue, or a feeling of loss that won't go away. And when the diagnosis finally arrives, some doctors still prescribe old-school antidepressants like amitriptyline or doxepin. These medications work. Yes, they hide a serious problem. They belong to the family of powerful anticholinergics, the same ones that block acetylcholine, a substance vital for attention, focus, and learning. A study published in 2015 in The People revealed that the higher the dose and the longer the use of these medications, the greater the risk of developing dementia. And the problem rarely appears all at once. First, the person begins to feel more sleepy during the day. Then comes difficulty concentrating. Over time, these impairments affect speech, spatial orientation, and the ability to perform basic tasks, such as cooking, getting dressed, or remembering where they put their keys. It's a cruel paradox. The medicine that's supposed to help you feel better might actually erase the happy memories you still have. Furthermore, the sedative effects increase the risk of falls, especially at night, and can also cause changes in heart rhythm. And because older people have slower metabolisms, both in the kidneys and liver, these effects end up being more intense and long-lasting. If you're already taking a tricyclic antidepressant, don't stop taking it on your own, but it's worth talking to your doctor. Ask if it's possible to switch to a more modern antidepressant, such as selective serotonin reuptake inhibitors, SSRIs, which have less of an impact on acetylcholine. And of course, combine this with other approaches: a brisk walk, support groups, therapy, small social interactions, all of which oxygenate the brain and can do wonders for your mental health. Fortunately, current guidelines now recommend that, in people over 65, any tricyclic antidepressant be reevaluated after 3 months of use. This is a sign that we are beginning to pay more attention to the long-term impact of these medications on the lives and independence of older adults. If your mood has stabilized, it may be time to talk to your doctor about reducing your dose, calmly and cautiously. During this process, pay attention to signs like irritability, insomnia, or a drop in energy. The key is to take it slowly, respecting your body's timing. And in the meantime, a lifestyle change can help more than you might think. The Call Mediterranean diet, rich in fresh vegetables, fatty fish, olive oil, and nuts, has shown in several studies real benefits for mood, brain function, and reduced inflammation in the nervous system. Remember, no medicine works alone. The impact of any substance on your body depends on who you are, your genetics, your routine, your emotions, your life history. So take control of this conversation. Ask questions, challenge, get a second opinion if necessary. These are acts of responsibility, not only to yourself, but to those around you. When your mind is clear and healthy, everyone around you benefits. Now let's go to number 3 on our list: the bladder control medications. Having an overactive bladder isn't just a nuisance. It can profoundly affect your quality of life. Many older people, to avoid emergencies and accidents, end up taking medications like oxybutynin, ditropan, tolterodina, Ditrol, Auras, sulfasenacin, Vesicare. And yes, these medications can provide quick relief, less rushing to the bathroom, more confidence leaving the house, and more peace of mind in your daily life. But this relief for the bladder can come at a high cost to the brain. These medications are also part of the anticholinergic group, the same ones that block the acetylcholine, a neurotransmitter essential for memory, attention, and reasoning. Researchers at the University of California, San Francisco, found that people who frequently used these medications had smaller brain volumes and performed worse on memory tests compared to those who never used them. In other words, physical comfort may be exchanging neurons for silence. And this happens especially in areas of the brain linked to declarative memory, how to remember names and facts, and when abstract thinking. The saddest thing is that many people continue taking these medications for months, even years, without even asking their doctor if they're still necessary. Meanwhile, the signs begin to appear: increasingly frequent forgetfulness, difficulty organizing daily tasks, or that frustrating moment when the remote control seems like a puzzle. If you identified with any of this, it might be time to see a urologist and talk about it. Alternative solutions. There are options like pelvic floor exercises, the famous Kegels, physiotherapy, bladder rehabilitation, or even simply reviewing your dose. The important thing is to find the balance, where you take care of your bladder without sacrificing your mind. We now come to number 2, the statins. Statins, atorvastatin, Lipitor, simvastatin, Zocor, and rosuvastatin Crestor, are among the most prescribed medications in the world, and rightly so. They save lives by lowering LDL cholesterol and protecting against heart attacks and strokes. But as with everything in life, the key is the right dose and balance. Few people know, but about 25% of your body's cholesterol is in your brain. He's not a villain there, quite the opposite. In the brain, cholesterol helps build neuron membranes and serves as fuel for the production of neurotransmitters like serotonin and dopamine, essential for good mood, motivation, and focus. When statins reduce this cholesterol too much, some side effects can arise: mental confusion, loss of concentration, discouragement, and even apathy. A study published in the journal Pharmacotherapy reported that 5% of patients who complained of memory loss showed improvement after stopping the use of statins, always under medical supervision, of course. This doesn't mean you should abandon your treatment, not at all. For those with diabetes, a history of heart attack, or plaque buildup in their arteries, statins remain a powerful protection. The point here isn't to eliminate the medication, but rather personalize the treatment, finding the right dose for your body. The balance between protecting your heart without harming the brain. If you find yourself losing track of a conversation, or that what you once enjoyed reading now seems tiring or confusing. It may be time to review your lipid profile and talk to your doctor. Health is always a collaborative effort, and listening to your body is the first step to protecting it. In some cases, changing the drug molecule, spacing doses better, or including supplements such as coenzyme Q10, essential for energy production in brain cells, can go a long way toward minimizing side effects. Another simple but powerful strategy is to boost your diet with oily fish, nuts, seeds, and extra virgin olive oil. These foods help raise good cholesterol, HDL levels, without drastically lowering the total, preserving the balance between the heart and brain. The focus is twofold: protect your arteries and keep your mind sharp. The truth is that being more mindful of what you put on your plate and in your body can make a huge difference as you get older. And now, we come to the number one from the list: the feared and often invisible combined anticholinergics. This category does not refer to a single specific tablet, but rather to a silent mix of substances found in everyday medications. Small doses of acetylcholine blockers, distributed in syrups, tablets, and capsules, accumulate over time, unnoticed, until the effects begin to appear. It could be a cough syrup with diphenhydramine, a nasal decongestant, a digestive antispasmodic with scopolamine or atropine, or even a muscle relaxant such as cyclobenzaprine. In isolation, they seem harmless, but combined, or used for long periods, they create a snowball effect that can seriously harm memory, the attention, and until the autonomy of the person. A 10-year study of more than 3,400 elderly people revealed that those who regularly used anticholinergic medications had a higher risk, fewer percent higher, of developing dementia, even if they had stopped taking their medication years before symptoms appeared. The biggest problem? They are everywhere. In sleeping pills, in cold remedies, in abdominal pain remedies, in nausea remedies, and almost no one realizes that they are mixing substances from the same class. The message here is straightforward. Go to your medicine cabinet, grab the boxes, read the labels. Look for names that end with amina, such as diphenhydramine, scopolamine, amitriptyline, cyclobenzaprine, and be wary if you are using more than one product with this ending. If you have any questions, ask your pharmacist for versions without anticholinergic action. Often, a second-generation anti-allergic, steam inhalations, or light physiotherapy already solve the problem without harming the brain. The point is, the lower your total exposure to these substances, the lower the risk of paying this high price later on. But it's not all bad news. There are natural and affordable ways to protect your brain against cognitive decline. Science has already proven that certain foods strengthen synapses, reduce the brain inflammation, and help keep memory active. Next, we'll show 3 powerful foods that you can start including in your meals, in a simple and delicious way, to protect your mind naturally and lastingly.